Grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Alright, if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter. I'll put a link down below where you get great tips and tricks every day. If you're new to these video series, every Tuesday I go live on the social media streams to answer your questions you guys may have. A couple housekeeping things. Number one, let me know if you're watching this live or on the replay. And two, let me know where you guys are watching this from. I love so much to hear from your audience. Have your comments down below. Have your questions down below. I'll try and get through them as well. Mona Lisa, it's good seeing you. Amy's good seeing you as well. Roger and Blake, good seeing you. Thank you guys for watching on the live stream. Hope you guys are having a happy and healthy day. All right, we have some great questions we're going to answer and tackle in today's video. And as usual, if you have a question, let me know in the comments down below. But question number one, hey Dr. Islam, is something wrong if I have accidents when I'm an adult? Very common question. I'm actually glad we're talking about this because we're actually talking about what's called fecal incontinence. This is a very common problem that a lot of people have, and more importantly, a lot of people are suffering from, and they don't let us know. When you look at the trials and clinical studies about people who have fecal incontinence, a lot of the patients who suffer from this don't actually want to talk to their doctor about this because they're embarrassed. We have to make the initiative to ask about how your bowels are doing. And it's a very common problem, especially as we get older. So why does it occur? Mainly it occurs because the muscles in your bottom are not working correctly. They may not be having the right tone. They may not be having the right function. There may be medications that could be on that could be triggering that as well. Our rectum is actually made to hold solid stool. So if you have liquid stool that's there, it's going to seep out and more difficult to hold in. But in addition to that, your rectum muscles are mainly going to be contracted. And that's going to be a reason why you keep stool in there as well. So if you don't have good muscle tone, that can cause accidents to occur, which is why people have to wear diapers. So what can be done about this? So number one, we have medical therapies to help out with that. Sometimes we'll use medications like Imodium or Lomotil to help slow down the bowels or help out with the muscle as well. Sometimes we'll do pelvic floor therapy where we actually train the muscles to allow it to work more effectively and more consistently. Sometimes we'll change your diet by avoiding things like dairy. Maybe we'll put you on what's called a low FODMAP diet. Maybe we'll remove some of the supplements you may be taking that could be causing bowel issues like magnesium or laxatives or medications like that. But sometimes we don't have good medical options and we have to resort to surgery. There are surgical options to help improve the muscles and to help out what's going on. And sometimes we don't have good options. So we have to resort to things like diapers. And this is sometimes an embarrassing thing that a lot of people have to suffer from as well. But we know that this is a very common problem. And if you are suffering from accidents and you're having issues with this, come see somebody like me who can help to at least diagnose what's going on and potentially treat what's going on to help out with your bowel issues. Great question. All right, Tina, it's good seeing you as well. Thank you guys for watching on the live video. So Mona Lisa have a great question. Hey, Dr. Islam, is it possible to become lactose intolerant later on in life? I'm asking because within the last month, every time I have milk, including unsweetened almond milk or milk products, you get bloated and massive diarrhea. Absolutely. In fact, the most common reason for lactose intolerance is acquired lactose intolerance over time. And yes, you can get this over time. I myself became lactose intolerant over time, and it sucked because I love milk and I love cereal, but I learned that this is a big issue for me, and yes, this can occur. Now, keep in mind, sometimes you can have an acquired reason why you're becoming lactose intolerant. So sometimes there could be an infection inside your small intestine. Maybe you're losing the strength of your villi as well. Maybe you have other conditions going on that could be causing you issues. And so sometimes we also want to take a look with an upper endoscopy to make sure we're not missing anything else going on inside the small intestine to become lactose intolerant. But it is very common to have this later on in life. Now, so what can you do about this? So obviously, number one,
avoiding dairy products is going to be the fix, but it's hard to do. Number 2, you can go to lactose-free milk and have that. It's a very effective option. Number 3, you can take a lactate pill, which provides the digestive enzyme for you to metabolize dairy, get rid of milk, digest that properly, and to allow you to enjoy those particular foods so you don't have issues whenever you're having those particular yummy milk products. So great question. Naki, let's continue. Thank you for watching on the live stream as well. So Tori Brown, good question. Why can I have a bowel movement if taking senna laxative? It's only been happening for the 2 months. So I don't know in your particular case why that's the case. But obviously what we always worry about is if you're having a new change in your bowel habits, especially if you're over the age of 50 years old. This is something that's called a warning sign, which in our world could mean that something is going on inside that colon that we need to do further investigation on. And so if you are over the age of 45, we typically want to see what's going on. Sometimes it could be related to dietary things. So some of the things I recommend, at least initially, adding some fiber, maybe adding some magnesium, take some probiotic food, see if that helps out. But if this is a new change that's going on over the age of 45, this is something that needs to be investigated and certainly needs to be addressed so we can make sure we don't miss anything obvious that could be going on and fix and could be assigned to something else later on in life. Great question. All right. So Amy, yes, that pill is over the counter. That lactate pill is over the counter. Go to any pharmacy, ask for a lactate pill. Enjoy your dairy, enjoy your ice cream. This will give you that digestive enzyme that you need to hopefully enjoy those foods that you want. Good question. All right, perfect. All right, question number 2. Hey, Dr. Islam, are colonics healthy? All right, I love this question because I see so many people on social media and celebrities using colonics. Well, let me give you the lowdown literally on colonics. They are not healthy. No, they're not. Don't be one of those that gets suckered into trying to get a colonic. It is not good for you. It does not detox your colon. In fact, it could be dangerous. I have treated patients who actually had a tear in the colon from a colonic. In fact, I had a case a couple of months ago in which I had a very young individual who was having issues with constipation. She tried everything and she heard on social media that taking a colonic would be helpful for her. She tried it. She actually developed a tear in the colon, had to have emergent surgery. Don't do these colonics. Don't do these detoxes. They don't work. They're dangerous. They can change your electrolytes inside your body. And there is a chance, a good chance, you could actually develop a tear in the colon. Don't do it. Don't do it. Don't do it. Great question. All right, perfect. All right, Nakia, good question. I notice every time I ingest lettuce or make a salad, it bothers my stomach. Is there an allergen to lettuce? Thanks. Good question. So it's actually not there's not actually a allergen to lettuce, but lettuce very commonly is a food that's very difficult to digest. And so there are a lot of healthy foods out there, broccoli, Brussels sprouts, lettuce, that can be difficult to digest because of the fiber content that's there. And for some people, they have the difficult to digest that particular fiber. So what I would recommend, you may want to be tested for certain conditions. Certainly we can do blood testing to see if there's any particular allergens. Sometimes it could be a sign of a condition called gastroparesis or delayed gastric emptying. And that's whenever your food doesn't want to digest properly. And sometimes you just may be somebody who just cannot typically digest lettuce. So for me, I love Brussels sprouts, but I cannot digest Brussels sprouts. It is a disaster if I have Brussels sprouts. My wife hates it. It's just really bad. And unfortunately it may become that, but there are other testing that we can do to see if there's certain things going on. One of the things I would recommend is that this usually can be a sign of a change in your gut microbiome, which you have too much bad bacteria and not enough good guys. And so sometimes introducing on a slow basis, fiber over the course of a time, go low and go slow, can sometimes help out with that as well. So it's a great question. All right. Question number 3. Hey, Dr. Islam, why do I poop when I'm nervous? Let me know in the comments down below if this is somebody who you are like, because I did this. In fact, I still do this. If I have to give a big talk, maybe I'm doing a big presentation, I actually have to use the restroom. Yes, I'm going to admit to that. Let me know in the comments if that's you. It's very common. This is actually part of our parasympathetic nervous system and our sympathetic nervous system as well. It's our nerves in our GI tract that actually cause the contraction of your colon to become more rapid, more fast, and cause you to rapidly empty your bowels as well. It is a normal response to a nervous reaction, whether it's anxiety, whether it's speaking in front of a large group. It's a very common problem that occurs. And this is the reason why a lot of our patients who have anxiety or a lot of issues like that, we treat the anxiety to help out with the gut issues because the connection between the brain and the gut, there is a common connection that's there. And whenever you're anxious up here, it can manifest inside your GI tract. So it's very common to have to feel the urge to use the restroom whenever you're nervous. Some of the things I recommend, number one, actually use the restroom. Yes, do it. It's okay. Not a big deal. Number two, sometimes taking something like an Imodium or an anti-diarrhea medication will help out with your bowels to help calm things down. Number three, relaxing as much as you can. Taking a deep breath, going for a walk, getting outside that environment that's going to make you stressful will help out with this as well. But it's a very common response, all due to our nerves, between the connection between our brain and our gut. Not a big deal whatsoever. And if this happens to you, you're like me, you're in that group in which your bowels act up whenever you're nervous. All right, perfect. All right, Saeed, good question. How long can a stool softener be used? I have chronic constipation. It's a very good question, and this really depends on what you're using. So a laxative like Miralax is a very safe medication to take. It's been around for a long time. We have a lot of good clinical trials on Miralax, and so far, the data for years and years and years suggests that it is a very safe medication to take, so it's very safe. Now, it also depends on stool softeners, which stool softener that you're taking, because there are some stool softeners that actually can slow down your colon and get your colon used to taking it, which can make it more difficult for you to get off. And there are other stool softeners that are very safe to take as well. So it really just depends, and each individual is different. But I can tell you long-term laxatives like Miralax, especially if you've had chronic constipation and this has worked for you, is a very safe and effective option. And for a lot of my patients who have constipation, I tell them take Miralax. It is safe, it is effective, your colon will not get used to it, and it is a good medication to take. We have very excellent long-term data when it comes to taking Miralax or medications like that. Good question. All right. So, Margaret, good question. Hey, Dr. Islam, why is my belly making so much noise when I'm full? So there's actually a medical term for this. This is called boroborygmy, in which your colon actually moves things through and makes noise. This is a very normal, it's a very normal response. What could be happening in your case is that fullness of your stomach or food in there, it could be churning and moving things through, and it could be causing the movement of your food into your small intestine. The other thing that could be going on as well is that you could be having a lot of gas inside that stomach, and that rumbling and hearing that you're hearing is just a lot of gas that's there. So you may want to cut back on having gas-filled foods. You may not want to consider incorporating things like Beano or Gas-X to help decrease the amount of gas in your GI tract. If you're using a straw, make sure you don't use that. If you're a sloppy eater where you eat very, very quickly, don't do that. Slow down so you don't air swallow or swallow as much air as well, because that's a very common reason to have gas in your stomach. But keep in mind, this is a very normal response. This is a very normal condition. It's called boroborygmy. And unless it's causing you a lot of discomfort or problems, or people notice it, or it's embarrassing, I honestly would not worry about it too much. Great question. All right, next question. Hey, Dr. Islam, why do I still feel constipated when I have watery stools? What is going on? So this is a very common problem. I would love to hear in the comments down below if you've had conditions like this, or you know somebody who's had this issue as well. This is called overflow diarrhea. So in essence is that you have stool in your colon that's so impacted that stool just seeps through it and actually causes diarrhea to occur as well. This is why you're having watery stools. So the treatment for this is that we have to get you flowing and get you going. And it's sometimes mind-boggling to my patients when they're having diarrhea like this to tell them, hey, I'm going to cause you to have more diarrhea, because we have to get your bowels going. We have to get your bowels moving, and this is going to help out with that overflow diarrhea. So I would highly recommend you really start to move your bowels and get things going. Try some Miralax, try some magnesium, add some fiber to your diet. If that doesn't work, try some medications that we offer for our patients for constipation. Even though it may seem kind of wacky, And then I'm treating diarrhea with more diarrhea. It's a very common problem. In fact, for a lot of my patients who fluctuate between diarrhea and constipation, this is the issue that's going on, is that you actually have more constipation, then you have overflow diarrhea going across that, and we have to get you flowing, get you going, to get you more effective bowel habits to actually fix the root cause of what's going on, which is that overflow diarrhea. All right. Julie, good question. Like others, I have problems staying regular when I travel. Do I have any suggestions? Well, Julie, that happened to me as well. I was gone on vacation for July 4th, and man, it sucked because I was not regular. Usually I'm like okay, I'm gonna talk about my own bowels right now. Usually I go at clockwork in the morning. I'm good. I have my bowel movement and I am happy throughout my day. But when I travel, it sucks. It is terrible. I have a hard time as well. So here's what I recommend. Number one, you really have to drink water. I know that when I travel, I do not drink enough water. I drink way too much coffee. I just enjoy myself. I have tea. I don't drink enough water, so I incorporated water. Number two, I actually took Metamucil or Benefiber with me. I added fiber to my diet to keep me more regular and to help improve the consistency of my bowel. So I would add in fiber. I would actually take Benefiber. I found Benefiber to be a little bit more effective. It has less bloating, less side effects. I incorporated that into my diet. Number three, even though I mentioned the coffee actually works as a natural laxative. Try and introduce coffee as well. Number four, you may want to consider adding magnesium at night. Magnesium actually helps you to relax your colon, to allow things to pass through, and it makes it easier as well. And number five, I would really recommend try to incorporate more and more vegetables in your diet. I know it's vacation. I enjoyed my vacation, but I really had a big helping of vegetables to help me go and get me flowing. And this helped me when I travel. And I recommend this to my patients when they're traveling as well. Great question. I'm glad you asked this because I actually had the same issue. And I thought, what would Dr. Islam do? And I followed my own advice. It actually worked. And I actually felt a lot better as well. All right, perfect. Candy, perfect. Thank you. Appreciate it. Thank you for allowing me to be your doctor as well. So Margaret Paul, good question. Is sweetener good to use? Well, this is a very good question. So let's talk about this. So artificial sweeteners, here's what we know. We know that artificial sweeteners do change your gut microbiome. We do know that artificial sweeteners increase the amount of bad bacteria, decrease the amount of good bacteria. What are the long-term clinical consequences of this? We're not 100% sure as of now, but we do know there is a change in your gut microbiome. What we also know is that there are certain individuals that cannot digest artificial sweeteners, so they get bloating, distension, diarrhea, and gas. And so, for those individuals, I am going to recommend for you to not include artificial sweeteners because you're going to have bloating issues and gut issues. But in terms of overall health, we don't quite know yet. I will tell you, I think we're going to find out that artificial sweeteners, by changing the gut microbiome, is going to lead to long-term consequences later on. What those consequences are, I don't think we know at this point in time what they are. So my recommendation, if you want to have a healthy gut microbiome, try to eliminate or minimize artificial sweeteners. If you're having gut issues already, bloating, diarrhea, not feeling good, you may want to go ahead and eliminate those artificial sweeteners and see if that makes things better for your GI tract. Great question. Taz, good seeing you. Thank you for watching in Orlando. Ron, I love this question. Hey, Dr. Islam, is it harmful to hold gas in? Especially around people. The answer is no. I love this. So it is not harmful to hold in gas. You're not going to cause your colon to explode. You're not going to cause gas to, cause problems. But here's the issue when it comes to gas. There's only two ways it can go. Either above or out. So sometimes if you hold in gas, it may get absorbed into your GI tract. Maybe it can cause bloating to occur as well. But overall, it is very safe to hold in gas. It is not a problem. What you should not do is hold in poop, because that can lead to long-term problems with constipation and a condition called pelvic floor dysfunction. So poop, don't hold in. Gas, not a big deal. Hold it in, or if you want to let it rip, not a big deal. Everyone does it, but there's not going to be any long-term consequences with holding gas in. Great question, Ron. I love that. All right, perfect. All right, good. All right. Well, great, guys. Well, guys, I want to thank you for watching on today's video. A couple things. So, number one, don't forget to smash that like button, like, share, and subscribe. And number two, if you know anybody who would enjoy these videos, share this video. I would love to get more people to watch this live. And number three, if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks every single week. I look forward to seeing you guys next week, 8 o'clock p.m. Central Standard Time on Facebook and YouTube and all the other social media channels. Hope you guys have a happy and healthy day. Take care, everyone. Don't forget, let's talk about poop. Thanks, guys. Appreciate it.